Never has discussing health on a global scale been so important, and never in history have we had the resources and technology to tackle a pandemic in such a collaborative and quick fashion. But it's not enough, and that is why we will continue the conversation here. Hello and welcome guests. My name is Victor Shiblie. I'm the president and publisher of the Washington Diplomat, a media and events management company in Washington, D.C. that works very closely with the diplomatic community in our city. I want to thank all those who are participating, some as far away as in Indonesia, Nigeria, UK, the UAE, Brazil, Belarus, India, Qatar, and many more countries. I also want to thank our speakers. Many of them are very busy on the front line of tackling the corona pandemic, which has sickened more than 163 million people and killed 3.5 million and devastated much of the world economy. In the next 2 days, you will hear many sessions on health-related issues. Not all sessions will be about COVID, but somehow I think all of them will touch on COVID and how it has infiltrated just about every segment of healthcare. I want the experts to talk, so my introduction will be very short. I need to thank our sponsors who help us put this together: Cigna, Children's National Hospital, the George Washington University, Kaiser Permanente, Home Care Connections, and Duplain Global Enterprise. And thank you to our diligent staff, including moderators Anna Gavell and Eric Ham, and the rest of the team: Fuad Shiblie, Rod Carrasco, Emily Matthews, Isabel Ames and Matthews, and Jessica Borich. I want to tell you about this platform, the Hopin platform. This is a new virtual platform that's popped up during the pandemic. And I assure you, once the pandemic is over, we'll move to traditional in-person events, but with a hybrid component with platforms like this. I encourage you to try the networking. It's the most effective way to meet people on this platform. There's 3 ways to do it. You can click the networking tab and be matched with somebody for 3 minutes. You can click to connect with them and exchange profiles. You can click on the people tab and you can look up and connect with people directly, or you can schedule a meeting with up to 4 people under that people tag. And now I would like to introduce our first 2 speakers who will give opening remarks. Then we'll jump into our first session where Anna Gavell will talk to Dr. Bashara Shukir, who has been responsible for overseeing the vaccine effort for the Biden-Harris administration. They'll be joined by Apoorva Mandavelli of the New York Times. And before we start that session, I'd like to introduce you to Stewart Simonson, Assistant Director General of the World Health Organization, for a short message. He'll be followed by Her Excellency Rosemary Banks, New Zealand's ambassador to the United States. Many people have ranked her country as the world leader in handling COVID. They'll both be speaking tomorrow's session on COVID on a global scale. And please stay as long as you can today and tomorrow. Ladies and gentlemen, enjoy the conference. Mr. Simonson.
Thank you, Victor. In our interconnected world, there are few things that demand international cooperation like health. The late Nobel laureate Joshua Lederberg wrote, "Bacteria and viruses know nothing of national sovereignties. The microbe that felled one child on a distant continent yesterday can reach yours today and see the global pandemic tomorrow. Never send to know for whom the bell tolls, it tolls for thee." When Dr. Lederberg wrote this, it was prophetic. Today it is fact, and that fact is at the very core of the World Health Organization's work at the far corners of the earth. The World Health Organization was established in 1948 by 61 member states. Today, the organization has 194 member states and is headquartered in Geneva. WHO has 6 regional offices and 150 country offices. The organization has an annual budget of roughly $3 billion and a full-time staff of approximately 8,200. Dr. Tedros Adhanom Ghebreyesus of Ethiopia is the Director General of WHO. Before I touch on COVID-19, I'd like to give you some context for our work using 2 examples: smallpox and influenza. Arguably, the greatest achievement of the multilateral system was the eradication of smallpox in 1980. It is the only human disease ever to have been eradicated, and it was done by WHO and its member states. Smallpox was a scourge going back to at least 1100 BCE. In the 20th century alone, some 300 million people are thought to have died of smallpox, and those who survived were often hideously disfigured. But at the height of the Cold War, it was the USSR that first proposed the eradication of smallpox, an initiative that was later led by an American. Friends and enemies alike united against this common foe, and it could only be achieved this way, in an organization that left no part of the world physically or politically inaccessible. The eradication of smallpox was only possible because of international cooperation. The 1918 influenza may very well have been the worst pandemic in history. According to John Barry, author of The Great Influenza, the 1918 influenza killed more people in a year than the Black Death of the Middle Ages killed in a century. It killed more people in 24 weeks than AIDS killed in 24 years. Worldwide, the 1918 claimed between 50 and 100 million lives. Adjusted for today's population, that would be equal to between 200 and 400 million lives. And unlike smallpox, influenza remains a potent, naturally occurring threat to humans. The only way to keep influenza in check is to relentlessly track it. And this is complicated, laborious work, collecting and analyzing millions upon millions of specimens each year. WHO has been doing just this since 1952. WHO's Global Influenza Surveillance and Response System monitors influenza around the world with 144 national influenza centers, 6 influenza collaborating centers, and 4 essential regulatory labs. For nearly 70 years, WHO has been refining and improving this network, which is the only thing that stands between us and the next 1918-like pandemic. It is a model of multilateral scientific collaboration. As you know, COVID-19 is thought to have emerged in Wuhan, China in late 2019 and became known to WHO on December 31st. After several weeks of investigation and scientific deliberation, Dr. Tedros declared it a public health emergency of international concern on January 30th, thus beginning the largest and most complex emergency response in WHO history. And this response has seen many achievements, some historic, but none could compete with the swift development of vaccines against COVID. Exactly 1 year after the outbreak in Wuhan became known to WHO, the first COVID-19 vaccine was listed for emergency use. And this achievement cannot be overstated, but it also raises important and sobering questions. Of the approximately 1.5 billion doses administered to date, 82% have been given in high and upper middle income countries, yet less than 1% has been given in low income countries. The virus itself, though, is much more egalitarian, and therein lies the problem. Where viruses have free rein, they mutate, and these mutations produce variants that eventually will outsmart the vaccine. So we will see more and more variants emerge. Indeed, COVID-19 may very well become like influenza, an annual threat that requires annual vaccination. But if we learn from our experience with COVID-19, there is something positive that can come out of this. As bad as it is, COVID is not the 1918 influenza or smallpox. COVID isn't nearly as lethal. And importantly, we have vaccines against COVID that work well. But we need more vaccine production expertise and capacity, more on every continent. And we need well-resourced health systems in every country to support pandemic preparedness and response. And we need international cooperation. Individually, we are no match for nature, but together we are. So if we learn from these lessons and prepare accordingly, we will be ready when nature confronts us with the next pandemic. Now, please welcome the Ambassador of New Zealand to the United States, Ambassador Rosemary Banks.
E ngā mana, e ngā reo, e ngā karangatanga maha, tēnā koutou katoa, which is a greeting in te reo, the Maori language of Aotearoa, New Zealand, an acknowledgement of all the participants and a welcome. First, a big thank you to Washington Diplomat and your sponsors for bringing us together to discuss a topic which has never loomed larger in our consciousness than it has over the last 15 months. We know there's nothing more important than our health, mental and physical, and the policies, the providers, and the international organizations that support it. But in good times, it's easy to forget that our capability and our productivity both as individuals and as nations, depends upon our good health. The pandemic has been a stark reminder of this reality. COVID-19 has shone a harsh and unforgiving light on our health systems and reminded us of our vulnerability to global supply chain blockages. The impacts are well known to us. We've lived them here in the US, and our hearts go out now to the less fortunate countries who are taking such a savage toll of loss of life and damage to social and economic fabric. The global crisis can bring out the best and the worst in us. We've seen resilience, compassion, we've seen inventiveness and the incredible speed with which the major pharmaceutical companies have been able to produce effective vaccines. But we've also seen protectionism, export controls on pandemic-related supplies, disinformation, and downright racism against people of Asian ethnicity. Confronting a shared global threat should bring us together, and we hope it won't continue to divide us. But we do have the opportunity to face up to our failures and to come out of this shared global experience stronger and with better systems in place to protect us against the next pandemic. I expect you've heard that often quoted quote from Winston Churchill. He reportedly said, "Never let a good crisis go to waste." I think the context was when he was involved in negotiations to set up the United Nations after the destruction of the Second World War. Well, we're in a very different context, but we do have the opportunity to build back better, as President Biden likes to say. And today it's about sharing that experience and learning from each other. But today is about more than response to emergencies like the pandemic. The discussion will cover many dimensions of health and well-being, and it will bring together different perspectives from different cultures and systems. I'd like to just share a little bit from New Zealand Maori culture about the way they see health. They see it, and I think this will resonate with many people, they see it resting on 4 different pillars. Ideally, a well-adjusted, socially well-connected person has all of these. The first is taha tinana, or physical well-being. The second is tina hinangaro, or mental well-being, emotional well-being. Thirdly, taha whanau, which is being socially well-connected, an important part of health in the Maori worldview. And the last one is taha wairua, or spiritual well-being. So back to the business of the conference. There's much to exchange and much to learn. So I'm sure that the conference organizers are going to lead you through a very enjoyable, interesting, and productive session. So thank you again, Washington Diplomat and sponsors, and thank you for giving me the opportunity of these opening remarks. Kia ora.